My name is Dr. Jeff Kinseth, and I practice in Dana Point, California, and I've been practicing for 25 years. I've been to many surgical courses in my life, and I find Dr. Zahidi's course one of the best. I've been extracting teeth, placing bone grafts in sockets for years and years, and then sending patients off to the specialist to get implants, and I feel like I'm doing all the hard work and I should be placing the implants, and this course has prepared me extremely well for placing my own implants. I feel comfortable and confident now that I have the ability to do that for my patients. With Dr. Zahidi, I'm going to call him Charles because he is a very fun person to be with, and very excited about and passionate about his work here. One of the things that he does, and I feel so fortunate to be a part of, is treating veterans. I have always felt that the military and the veterans are the most important part of our country, and I feel extremely proud to be helping out veterans with this continuing education course, that I'm improving their lives and improving my continuing education at the same time. I feel very proud about doing that. I wasn't really feeling very comfortable going to other countries, placing implants in a foreign country that I really wasn't able to determine whether the techniques were proper or what the guidelines were over there. I felt very comfortable staying in the United States with Dr. Zahidi's course, especially treating our own veterans. That was the main reason why I chose this course. I highly recommend this course to any general dentist or specialist who wish to place more implants, learn about bone grafting, and just higher their education.
So my name is Vu Lee, and I'm a general dentist in Foothill Ranch, California. I originally planned to attend this class just so I could get a live surgery course here in Orange County, where I live. I have 2 small children, I can't travel easily, and for me, the chance to do a live patient here in the United States and sleep in my own bed at home at night and see my kids every night was really important to me. But what I didn't realize until after I'd signed up, but it became a really special, I'd even say a blessing for me, is that our patients would be veterans. Veterans are very near and dear to my heart because I am a Vietnam War refugee. At the age of 2 months, I was forced from my home by the Vietnam War. And if it wasn't for brave American veterans, Marines, Army men, Air Force men, Navy, who risked their lives in a war that nobody wanted and came home to a country that didn't appreciate them. Well, I appreciate them. And so for me, just the chance to even to learn and to help the veterans of this country really was priceless. And so for me, this class holds special value to me. Yes, I've been to many implant courses, and yes, I've seen lots of procedures, sinus lifts, both side and vertical approach. I've seen implants, I've seen mini implants being placed, I've seen all sorts of things. But for me, having this opportunity just to both learn and to serve with veterans who have served our family so invaluably was especially wonderful. So I really recommend this course to anyone who appreciates veterans even a tenth as much as we do, because we can never do enough for them, and we should always learn and we should always serve. Yeah. So Dr. Zahidi tells a lot of jokes, and he's very funny, and he, or at least he thinks he's very funny.
My name is Irina Pomatasio. I'm from St. Helena, California. I've been to several different courses sponsored by other implant companies and found this one to be really fantastic hands-on treatment for cases of complication in order to make simple cases in my own personal practice and life on a daily basis easy. This has been a fantastic course. Dr. Charles Zahidi is very friendly. He leaves a lot of time after the hands-on portion in order to do a question and answer, which is open, friendly, approachable, practical, and applicable. It's a fantastic course as well to be able to treat our veterans who have done so much for our country and for ourselves to be able to be here and practice in this manner. I recommend this course highly to anybody, especially generalists, who want to further themselves in their practice course for extractions, complications, bone grafting, suturing, and even periodontal issues that you may encounter on a day-to-day basis and that you don't expect. Another important practical portion of this course is learning how to protect yourself, especially here in California where your license is so hard to obtain. Things like informed consent, pre- and post-operative instructions, so forth and so on.
Hi, I'm Dr. Dina Marcus, and I practice in Sonoma. And this is a great course. Dr. Zahidi's been very helpful and hands-on training to help us deal with some difficult cases of implants and extractions and grafting. This is the second hands-on course that I've taken, and it's wonderful to be able to practice and do a great job for our veterans at the same time as get very practical hands-on training in the United States. Been to a few courses, and this one was definitely beneficial to be able to do good treatment for our veterans as well as good hands-on training for us safely.
Hi, my name is Dr. Abigail Cho, and I'm from San Francisco. I've been taking a lot of bone grafting and implant hands-on courses and theory courses because 60% of our patient population is geriatric patients. So I've been really interested in placing implants. I've been really fortunate to take this wonderful course. One day it was theory, and then 2 days it was placing implants on patients. And Dr. Zahidi, Charles, was with us throughout every step. He's very passionate, and it was very exciting to place implants on live patients in a very strategic manner, but also with so much pride and thankfulness to the veterans. So this has been by far the best program I've been to, and I think I want to continue to be participating in this dentistry for veterans. So it's pretty much changed my life, not in implant dentistry, but also in my view of providing my service to this country and to the people that have served our country.
My name is Dr. Samir Tadros. I have my practice in Laguna Hills. Well, this course is one of the excellent courses, I would say, because it carries also a value of treating the veterans who actually protect us day and night. So it's not just a training course as any other training course, but also it carries with it a noble value. What also I like about this program is basically the cases are not pre-selected in the sense like it's the easy cases, the straightforward cases, where you actually in real life you cannot, when you are confronted with normal cases, you cannot really handle it. This one is basically, it takes the cases as they are, and then with all the complication and how to handle those complications in the real life scenario. That's what also makes it very unique course. I would recommend this course to many other colleagues who wants to start it, or to start, basically placing implants. It's not too late. It's always good to start from one point and advance, and I would recommend this course. Thank you so much.
My name is Dr. James Repperman. I'm from Pittsburgh, Pennsylvania. I have came to the course offered by Dr. Zahidi based off of the need for me to learn how to place implants. It has been a desire of mine for some time. This course comes highly recommended. It's a very informative course, hands-on, which is most important. We go ahead and it's demonstrated to us not only the aspects of performance in placing implants, but as well as to any possible complications and or possibilities to eliminate those potential of, let's say, lesser outcomes. Dr. Zahidi is very informative. He makes us all work within the realms of the course so that we maximize our education. We do work on veterans. I also am a veteran, therefore I feel honored to be working with my brotherhood of other veterans. Okay, the patient that I actually did my first surgical implant placements on yesterday, besides being a veteran, was also a motorcycle enthusiast like myself. We spoke yesterday about how I personally came out here last August with a group of people and rented Harleys and did the Pacific Coast Highway up north to above San Francisco. What a wonderful, beautiful state you have here, and to enjoy it on two wheels and having the patient talk to me about other sites in California, was very beneficial in the sense that we communicated as patient-doctor as well, which Dr. Zahidi has also emphasizes to us during the course here as to how communication is dealt between patients and the doctor and how acceptance can be made. Very informative on all aspects of dentistry, implant dentistry. I have brought my assistant, Ms. Tina McKee. I actually, to be honest with you, feel very honored that she's willing to learn as she does, but more so than anything, she's my right-hand person, and I definitely need her to know what is going on, how I'm going to do things, and actually as a second guide, because sometimes I can't remember everything. I think it's very important that she came to this course here, basically because she can also add the things that I may not have remembered, or just give a suggestion. I think that it's paramount that all assistants come with their doctors if possible, regardless of the little bit of extra expense, because it is a team effort within dentistry, particularly implant dentistry. We must know on all facets of auxiliaries to the doctor what is going on.
Hi, my name is Tina McKee. I am from Pittsburgh, Pennsylvania. I came to this implant seminar with Dr. James Repperman. I've been assisting with Dr. Repperman for over 13 years, and I think this course is very beneficial for assistants to come to, even though it may be a little bit more of an expense for the doctors, because the knowledge that you learn in the hands-on is amazing. It's a lot of information. You can really help the dentist or your doctor, assisting it would be much better.